going to bring him up into neutral dorsiflexion. Okay, that is going to put the wedge of the talus within the ankle mortise. It's going to help us stabilize the talus rather than having to expend a whole lot of energy fixing the talus by hand. Okay, so here, and we grab onto the calcaneus here. My thenar eminence is going to go right up against the anterior edge of the calcaneus. My fingers are going to wrap around the lateral posterior edge of the calcaneus. Okay, so to produce eversion, I'm going to push the anterior compartment laterally, and I'm going to pull the posterior compartment medially. So all I'm doing when I'm producing this movement is a radial deviation with extension of my wrist. Just like that. Dorsiflex, radially deviate with extension. This anterior compartment's a little stiff there on that version. And then if you want to determine whether the problem is in the anterior or posterior compartment, because there are options there that you can do differently for treatment, all you have to do is focus on the particular component that you're suspicious of. All right, so here, and then I'm checking the anterior compartment. That's a little jammed up. Here, and then pulling for the posterior compartment, if that's the portion I'm suspicious of. Pretty simple, right? Yeah. So if I do this, right? So in his case, I bring him up, and I'm checking eversion. It feels stiff to me, right? So what I want to confirm is this the anterior compartment or the posterior compartment? So all I'm doing is I'm either focusing on the push with the thenar eminence, or focusing on the pull with my fingers to decide if it's the anterior or posterior compartment. And right there, that anterior compartment just feels a little gummed up to me. Okay. Now if I want to do inversion, the only thing that changes is I'm switching hands. Up into dorsiflexion, grasp the calcaneus, and that's inversion. Swinging the anterior compartment medially, pulling the posterior compartment laterally. Ta-da. Any difficulty with that?